Okay, everybody, Dr. Rafich here from Vet Triage. We are on the last article for JAVMA, the June 15, 2015 edition, Bovine Viral Diarrhea Virus Outbreak in a Beef Cow Herd in South Dakota. This study comes out of the vet school in South Dakota. And let's get into it. This is a fairly unique paper in that it's not really a case series per se. It's more of an epidemiologic study, which is cool because, again, considering COVID, these are the kinds of things that emphasize to the general public how complex these investigations are. And when you're talking about something that's global like COVID, you can imagine once you go through this, the challenges of that. This is just one herd in South Dakota. It's 136 animals, right? So it's like nothing compared to the entire population of humanity. So just have some appreciation for that. We'll get into it. Case description: 136 pregnant beef cows were purchased in 2003. Then in the spring the following year, 128 cows calved as expected. 8 cows were believed to have aborted with the fetuses unavailable for evaluation. Of the 128 calves born, 8 died within 2 weeks after birth, and 9 were born with congenital abnormalities. Clinical findings: cows and their calves were evaluated for bovine viral diarrhea virus, which is BVDV infection. 44 of the 120 calves, but 0 cows tested positive for BVDV antigen by immunohistochemical staining of ear notch specimens. Regarding treatment and outcome, 5 viral test positive calves died shortly after weaning. The remaining 39 viral test positive calves were moved up to an isolated feedlot and retested at 5 to 6 months old. 36 were positive, which indicated that they were persistently infected with the virus, whereas 3 had negative results, which indicates that they were transiently infected. All the persistently infected calves were infected with the same type 2A strain of virus. As yearlings, 17 of the 36 persistently infected calves died peracutely with lesions consistent with mucosal disease. 6 died without gross lesions, 2 were euthanized. The remaining 11 persistently infected calves appeared healthy and were sold for slaughter. Screening of the following year's calf crop for the virus by use of immunohistochemical staining of ear notch specimens were negative for all calves. Clinical relevance. Introduction of this virus into a naive cow herd resulted in a loss of 44% of the calf crop subsequent to reproductive loss, poor thrift, and mucosal disease. All right, introduction. And actually, I think this is introduction and introduction and the case series. Bovine viral diarrhea virus antigen was not detected in any of the ear notch specimens obtained from the cows, but was detected from the ear notch specimens of the 44 of the 120 surviving calves, making up 37% of the calves, including 5 of the 9 with congenital abnormalities. Further genetic analysis of the virus antigen detected in positive ear notch specimens performed by the National Animal Disease Laboratory in Ames, Iowa, revealed that all calves were infected with the same viral type 2A strain. The calves were weaned in August, and 5 of the 44 positive died shortly. Blood samples of approximately 10 milliliters collected by jugular venipuncture into an evacuated blood collection tube containing EDTA. The Buffy coat fraction was recovered from each sample and submitted for viral isolation, which was performed by the tube method, and for a viral antigen capture ELISA. To obtain serum for determination of neutralizing antibody titers against the viral types 1 and 2, the serum neutralization assays were performed in accordance with methods recommended by the World Health Organization, with a cytopathic Singer strain used as the reference strain for type 1 and cytopathic A125 strain used as a reference strain for type 2. So there's type 1 and type 2 for this virus. They go through then this tree, which if you want to look at it, you can pause the video and read that there. I'll go through it briefly here. They start out with 136 pregnant cows purchased by South Dakota University. Pregnancy loss were 8. So 120 calves were born. Of those, 8 calves died less than 1 month of age, 9 calves born with congenital lesions, and 111 were normal. So of the 9 and 111, ear notch specimens were collected and stained for immunohistochemistry for the virus. 76 of those calves were negative, 44 positive. Weaning and transfer to isolated feedlot of the positive cows. 5 calves died at 1 to 3 months old. So then 39 calves were retested for the viral antigen capture ELISA on buffy coat and viral isolation. 3 of those calves were negative, 36 positive. Of those positive, 2 were euthanized, 11 were looking like they were healthy and they were sold to slaughter, and then 23 calves died and were necropsied. 6 had no lesions, 17 had mucosal disease. Results indicate that 74% of calves had lesions consistent with the viral mucosal disease, which include extensive erosions and ulcerations throughout the gastrointestinal tract, whereas the remaining 26% did not have gross lesions. The mean birth weight for the 44 calves that were positive by antigen for immunohistochemical staining of ear notch specimens, which were 35 kilograms or 77 pounds, were significantly less weight than the mean birth of the 76 viral negative calves at 42.4 kilograms or 93.3 pounds. Discussion. This virus continues to be a major cause of reproductive disease in cattle. Currently, the viral strains are classified into one of 2 genotypes, type 1 and type 2, and they are subdivided into 2 biotypes, cytopathic and non-cytopathic, on the basis of whether a given strain causes lytic changes in cultured cells. Infection of a pregnant cow with non-cytopathic strain prior to 40 days of gestation can cause embryonic death, whereas infection between 40 and 150 days of gestation can result in a fetus that is persistently infected with the virus, and infection during the latter stages of the 2nd and 3rd trimesters can cause abortion or congenital abnormalities in the fetus, or less severe outcomes such as birth of calves with poor vigor or no clinical abnormalities. Cattle that are persistently infected with the virus are the major reservoir, and current recommendations to control the virus is detection and removal of persistently infected cattle. Persistently infected cattle that survive the first year of life die of mucosal disease, which results when an animal becomes infected with a cytopathic strain of the virus that is subsequently similar to the non-cytopathic strain with which it is persistently infected. So the cytopathic strain frequently emerges from a mutation of the non-cytopathic. Information regarding the mortality rate of persistently infected calves within 1 year after birth and the percentage of persistently infected cattle that die as a result of mucosal disease or appear clinically normal is lacking. The present report provided additional information about the clinical outcomes associated with the apparent introduction of a single strain of type 2 into a herd of 3-year-old pregnant beef cows. 44% of the 2004 calf crop for this herd was lost or otherwise affected by the virus. The present report highlighted the risk producers assume when they purchase pregnant cattle, a common practice in the beef and dairy industry. Currently, there's no affordable or safe method to determine whether the fetus a pregnant cow is carrying is persistently infected with the virus. The detection of maternal viremia is not a viable option for identification of dams carrying persistently infected calves because viremia is associated with the infection has a short duration, less than 10 days, and must occur during 40 to 150 days of gestation to result in a persistently infected calf. Screening pregnant cows for the presence of antiviral antibody titers is also not useful because persistently infected calves currently require neutralization assays which cannot differentiate between antiviral antibodies that result from vaccine and those that result from actual infection. The virus is an RNA virus that can generate variants during replication. Outbreaks of mucosal disease have been reported in 2 beef herds in Saskatchewan, Canada. In another report, 27% of yearling cattle were persistently infected and 71% died of mucosal disease. The presence of persistently infected cattle is a threat to the health and profit of cattle operations. An increase in awareness of the virus and using vaccines, surveillance, and eradication efforts will decrease the incidence of persistently infected cattle. However, until there is an affordable and practical way to screen fetuses The risk of introducing this virus to a herd should be considered whenever pregnant cows are purchased, and biosecurity practices like quarantine should be implemented until appropriate testing can be performed. Additionally, all cattle that die suddenly with or without gross lesions should be tested for the virus. The present report is a reminder that the diligence in viral prevention is vital for beef operations because a viral outbreak can be devastating. Although it is often recommended that any animal with a positive result for the antigen be culled, one positive result is insufficient to definitively identify an animal as persistently infected. For the herd in this report, 6.8% of calves that were positive by antigen from ear notch specimens were tested negative later on by viral isolation and by antigen capture from the ELISA, and were determined to be only type 1 at the time of testing. This finding emphasizes the importance of performing follow-up testing of the positive cattle to definitively determine whether they are truly persistently infected with the virus. Proper biosecurity and vaccination programs and the rapid identification and removal of persistently infected cattle are recommended. That's crazy. Yeah, I mean that's so much nuance, and that's only one virus. And these animals are prone to a bunch of viruses. So it's just wild. So for veterinarians, obviously client education so that they know how to test and what to look out for, quarantine, biosecurity. And then for owners of these beef and dairy lots, it's worth spending the money now before having to cull your entire herd or be part of an entire epidemic or even pandemic with diseases like this. All right, guys, for the next one, we're going to be going into Veterinary Surgery Journal. There it is. So hopefully you'll enjoy that. We'll see you guys in the next video. Take care.